Type 2 diabetics are overweight because that's how you get the type 2 diabetes, is being too weight, developing insulin resistance. And now you're tied to shots and pills and doctor's appointments and spending your whole day with your diabetes. Overweight people develop type 2 diabetes. It's a normal adaptive response. 12% of Chinese people living in China have type 2 diabetes. But the key thing on the second page, if I remember correctly, this article, it says, before 1980, fewer than 1% of the Chinese population had type 2 diabetes. Before 1980, 90% of the food source was white rice. This is 100% preventable disease. What you'll realize is that the reason people develop type 2 diabetes is an adaptive response so they don't become morbidly obese. Okay, so you put on an extra 20, 30 pounds of body fat, but the body says that's enough. Pretty soon you're not going to be able to outrun tigers. You're not going to be able to fit in the cave entrance. You'll freeze to death outside. 20, 30 pounds is enough to make it through the winter. And as an adaptive response, what the body does is it develops insulin resistance so that the insulin doesn't work as well. Why is that important? Because insulin drives fat into the fat cells. Insulin lets sugar into your regular cells. So when you develop insulin resistance, less fat accumulates. So you're less likely to become morbidly obese. It's for your survival. But because there's less effective insulin, you develop insulin resistance, your blood sugar goes up. When you get rid of the need for this adaptive response and you use the excess fat, you are cured. A type 2 diabetic makes as much, if not twice as much insulin from their own pancreas, not from shots, from their own pancreas, as somebody without diabetes. This has all been known for 50 years. When you lose weight, you cure type 2 diabetes. The most effective way to lose weight permanently is to introduce starch in your diet, and potatoes would be an ideal starch. Well, let's just take a minute on the glycemic index. This is something David Jenkins in 1982, he's a sort of a friend of mine from University of Toronto. He developed the glycemic index, published in 1982. And what he did is he fed people various foods and then saw what happened to their blood sugar over the next 120 minutes. All right. Well, you feed foods that don't have any sugar in them, which are animal foods, meat, poultry, fish, cheese, almost no sugar at all in cheese. When you feed these low sugar foods, then the blood sugar doesn't go up much. Whereas when you feed sugar in your foods, carbohydrate, starch, the blood sugar goes up. But is it a bad thing to happen? No. When you eat, that's what's supposed to happen. Your blood sugar goes up so you satisfy your appetite and you provide energy for your body to run on. Now, let's look at how the glycemic index is valued. What David Jenkins did is he made white bread or white table sugar the standard, all right? And that means 100%. That's the glycemic index is 1 or 100%. And then he compared eating various foods. And when you feed potatoes to people, compared to white sugar, which is 100%, they're 118%. Oh, you go bad. Well, if you feed Snickers bars to people, the glycemic index is 67%. And probably the lowest glycemic index food I know of is fructose. The glycemic index is 20%. Well, a high fructose diet is not only associated with obesity, but heart disease. So glycemic index is just one quality of food. And it has misled so many people. You eat for calories to raise your blood sugar. That's the way it's supposed to work. A diabetic knows their insulin needs and the reaction to food and insulin better than anybody else. So they ought to be able to figure this out very quickly. First thing is what I do when I take care of a type 1 diabetic who produces no insulin in the pancreas is I cut the insulin dosage that they're taking by at least a third. Sometimes I cut it in half. Why? Because low blood sugar is far more dangerous than high blood sugar. And then what I do is over the next period of time, I try and get their blood sugar somewhere between 150 and 250 milligrams per deciliter. To make it lower than 150 is dangerous. Children in particular shouldn't lower below 150 because of the risk of hypoglycemia. And then in time, what you do is you balance your activity, your food, your insulin dosage. It's easy if you put a little effort into it.